Hi, my name is Dr. Kimberly Johnson. I'm an assistant professor in the University of Cincinnati in the College of Nursing. My article entitled "The Effects of Interruptions on the Triage Process in the Emergency Department" was published in the Journal of Nursing Care Quality in October of 2018. So I'll tell you a little bit about that project and how I got there. So my research focuses on improving the quality and safety of care provided to patients in the emergency department. And I was really interested in looking at interruptions in healthcare because we know that that causes a significant problem. And I've been an emergency room nurse since 2001, so I know the emergency department and I know that we get interrupted. But I was really interested in looking at the triage process and how interruptions impact that process. So what triage is, it's that initial assessment that a nurse does when a patient comes to the emergency department. It's the patient giving their complaint or the reason why they're there, and the nurse conducting an assessment. And from that, determining an acuity level that the nurse will assign to the patient. And that acuity level sticks with the patient through their stay in the emergency department. So it's an indicator of how many resources are needed to care for this patient and really how sick they are. So it's an important assignment that's done there. So I was wondering, if we look at interruptions, and we know that it causes errors and problems and delays, and we see that in the literature with medication administration and all of that, how does it impact triage? Well, we don't know. We didn't know. So that's what this project was. So in order to look at the interruptions, I developed an instrument called the Triage Interruption Assessment Tool, and that we use to measure and categorize the interruptions. We say who's being interrupted and how and the impact that it has, and it's all captured in this instrument. So we use that to look at what's going on in triage. So what we found was that interruptions occur in about over half of all triage interviews. So 57% of all triage interviews were interrupted. We found that interrupted triages last about 2 minutes longer than uninterrupted ones, which doesn't seem very significant unless you have a really sick patient where those 2 minutes are really important. The other thing is they can add on to each other. So you have a 2-minute delay in a triage, that might not be a big deal that this triage is 2 minutes longer, but if this one is, and the next one is, and the next one is, and so on, you can have big chunks of time. And so critically ill patients have to wait longer to get triaged, and that can really be detrimental to their care. In this study, we found that interruptions were associated with negative outcomes in the patient, whether that was errors or delays. They were both associated with that, and it's a big deal. So that's what my research focuses on. And this is just one step in my research trajectory. So the next step is to really look at developing interventions that can help mitigate the impact of interruptions or eliminate interruptions. But we can't eliminate all interruptions, so we need to know how to decrease the impact of interruptions that do occur. So that's where we are. It's a really exciting place to be. So thanks.